A lot of work has gone into this Long COVID Physio Forum that I've been asked to MC or host for some reason from my living room, because that's what we do now. There was an online Twitter poll, should I wear the tuxedo? And then the answer was yes. And I said, should I wear the top half and the bottom half? And I will not disclose the poll results for that. But we first talked about Long COVID in 2020. We've been having similar conversations about Long COVID, about what we've learned for more than 2 years. So you've been listening, which I think is important to put first, listening and talking or communicating with people who are living with Long COVID before there was the term Long COVID. What are some of the bigger lessons that you've learned? You share a lot on your Twitter feed about the lessons that you've learned, but when I ask that question, what comes to mind?
Yeah, I think, one of the first things that we think about when we're trying to manage the care of someone with Long COVID or think about clinical trials for investigating an element of Long COVID is, I think the most important lesson we learned has been that naming matters, words matter, the characterization of symptoms matter, because there are so many ways that you can mess up what you're looking at or what you're looking for by assuming that somebody has Long COVID just because they're experiencing persistent symptoms after a COVID infection, but you're not thinking about the quality of symptoms they're experiencing, the frequency of symptoms they're experiencing, and the underlying pathology behind the symptoms that they're experiencing. So a concrete example of what I mean there is that somebody who has cardiac damage that they sustained because of a COVID infection, and they're still experiencing fatigue and exertional intolerance and shortness of breath and all of these symptoms that we might think, hey, this seems a lot like Long COVID, their physiology is going to look very, very different to someone who is experiencing symptoms that look more consistent with a diagnosis of myalgic encephalomyelitis. They did not have a severe COVID infection that resulted in cardiac damage, and now they're experiencing progressively debilitating symptoms. So I think that a lot of the misunderstandings and the misconceptions around how best to treat a condition like Long COVID comes from us not being curious enough as clinicians, us not being engaged enough to ask the right questions, to follow up a question with the correct follow-up investigation. So it's not enough to just stop at, are you fatigued? Yes, I'm fatigued. Well, tell me about the quality of the fatigue. Tell me about when the fatigue comes on, what makes it worse, what makes it better. These are skills that we as clinicians, we all learned in our schooling. And for some reason, for whatever reason, whether it be a lack of professional or academic curiosity or a lack of time or, just general burnout over the last few years, we're not asking the important questions that will tell us what these symptoms are like and how we can treat them.
Is it confusion? Is it fear? Is it because people don't, the phrase that comes to mind is confused people don't. But if you're a professional, if you're a rehabilitation professional, you need to educate yourself, right? You can't just say, I don't get it, and I'm going to walk away. So that's why, you having the keynote, one of the keynotes for Long COVID Physio Forum, confused people don't. What do we know as best practice right now? And that's what, to me, that's what this forum will do. It will share what we know. It will share people's lived experiences. So that's why I'm excited for this resource, because that can't be an excuse. You're a professional. You know how to do these things. I understand Long COVID didn't exist 2.5 years ago, but it does now, and you need to educate yourself. You need to ask those questions.
Absolutely. And, a lot of my presentations about Long COVID have been about rehabilitation management of Long COVID. But given the the scope and the breadth of the Long COVID Physio Forum that is upcoming, I actually feel really satisfied that we're going to have phenomenal clinicians talking about really common sense ways that clinicians can help to manage the symptoms, help to treat some of the symptoms of long COVID. So much so that is not what I'm going to focus on my keynote. What I'm going to focus on is the pathobiology. What do we currently know? What are we studying on the physiological side that shows us that people with long COVID are different from people without long COVID in black and white, clear as day? And how should clinicians integrate that into their practice to make sure that they're giving their patients, even if we can't cure a person with long COVID right in this moment, at the very least, by objectively categorizing some of the things that we will talk about in the keynote, they can give people with long COVID the best chance of making sure that insurance doesn't leave them out in the cold, making sure that short and long-term disability and workers' compensation claims are honored for these individuals who meet the recommendation of a person, meet the guidelines or the accreditation of a person with a disability under the ADA. And and really just make sure that we can take care of these patients long term as they continue to battle the symptoms that they're fighting as a result of their long COVID.
I tweeted at you recently. I said, "Hey, David, what are 3 things someone's going to walk away with from your keynote?" I'm going to read them one by one and just elaborate a little more. So number 1 was, after experiencing your keynote, people are going to learn how to be a better clinical provider to folks with long COVID and other infection-associated illnesses. It sounds like you were just talking about some of that.
Absolutely. So, one of the things that we are going to be doing in this presentation is walking through the current toolkit that we have to measure symptoms and to understand the extent to which a symptom is causing difficulties in participation and disability and so on and so forth. Because I think one of the things that, you speak about this idea of confused people don't, clinicians often get confused when they hear symptoms that are difficult to quantify. I am experiencing fatigue. I am experiencing post-exertional malaise. A clinician doesn't know what to do with that, so they write down patient reports, or even worse, patient complains of this symptom, that symptom. We're going to talk about how you measure those symptoms because, believe it or not, we have well-validated scales to measure severity of fatigue, severity of post-exertional malaise, severity of cognitive impairment. And we can do that using instruments that have been approved by the FDA in drug trials, for instance. So if a pharma company wants to test whether their drug is reducing fatigue, they will use a scale like the fatigue severity scale. And if they see a certain amount of mobility, they'll say, our drug is working. We as clinicians can do the same thing. And what's more important than that, if we're measuring these symptoms using these scales, when an insurer says to us, prove to us that your therapy is working, we can show mobility on the fatigue severity scale. And we can say, listen, yes, I know that 3 months ago they were reporting fatigue and they are still reporting fatigue 3 months on, but look at the change in fatigue levels. Or alternatively, we can say fatigue levels are not moving. We're not making a difference. We need to help this person get short or long-term disability benefits in place. And I think that one of the things that clinicians need to walk away from this talk from is they don't need to be helpless when a patient is telling them about symptoms that are largely subjective. They can measure those symptoms. They can measure some of the qualities of those symptoms, and they can start to, really objectively categorize the symptoms that people are experiencing. I also think it's just important for us to talk about the fact that the overwhelming narrative that we've heard both from clinicians and unfortunately from people with long COVID is, I got all of these tests and everything came back normal.
Yeah.
And, you know, I got to say, we recently, in collaboration with the American Association for Physical Medicine and Rehabilitation, published some consensus guidelines on treating autonomic dysfunction in long COVID. And, you know, one of the things we highlight is the fact that almost 70% of people with long COVID have autonomic dysfunction. And so when we do testing like a 10-minute stand test, we see symptoms emerge. A 10-minute stand test is the simplest thing in the world. You stand for 10 minutes. What do we see as you stand for 10 minutes? We see your heart rate start to increase over time. Often we'll see your blood pressure start to increase over time as well. And we'll start to see changes to your skin tone. Your skin will start to go splotchy. It will start to go red. If I press on it, venous return will be slowed down and impaired. This is something that we're seeing in a huge proportion of our patients. It is a positive test for autonomic dysfunction. And in most people with long COVID, not all, but a majority, it is positive. So it is unacceptable for me to hear all the time, well, I went to my PCP and everything came back normal. When all I need you to do is stand for 10 minutes in the same spot and your symptoms will emerge in most cases of long COVID. What that tells me is that our current clinical providers either are not giving patients 10 minutes of time to test these things, or they are unaware. Both of those outcomes are unacceptable.
Right.
We need more education.
The website, if you're listening along, is longcovid.physio, and you can check out the details about the forum. $50, scholarships available. Darren and the team were very, very insistent on making sure that this was not a barrier to entry. And yes, everybody loves asking, will the replay be available? The answer is yes. The second thing that you told us that you'd walk away from your keynote was how long COVID is an organic illness with emerging research that lines up biology and symptoms.
Yeah, I think one of the biggest challenges through the pandemic, as we have been exploring and trying to understand long COVID, has been the fact that we have a whole lot of symptoms and an incredible symptom load that causes extreme debilitation for most people living with long COVID. But it's very hard to identify hard and fast blood biomarkers and physiological biomarkers of long COVID. And so what we want to explore today, what we want to explore in the Long COVID Forum, and we will talk a little bit about today, is the fact that, in fact, we have been finding some pathobiological markers of long COVID. We have been seeing evidence of microclot formation, platelet dysfunction, of autoimmune dysfunction, of chronic inflammation. We have been seeing signs and symptoms of viral persistence. We have been seeing signs and symptoms of hormonal dysregulation. And these are all things that are measurable. And these are all things that, as we start to characterize the problem a little bit more, with a little bit more granularity, as we start to understand how different endotypes of long COVID can exist, how you can have an autonomic dysfunction subtype of long COVID and an autoimmune subtype of long COVID and a viral persistence subtype of long COVID, we can start to see that some of the symptoms will line up with some of the biomarkers that we're tracking.
Information we didn't have 2 years ago.
Information we did not have 2 years ago, information we didn't have 2 months ago. So we're really going to be presenting some data on the very bleeding edge of long COVID discovery from our lab here at Mount Sinai, from our collaborators at groups like Yale and the Polybio Research Foundation, as well as other groups around the world that have been doing some really intelligent and clever work.
David knows how to do a radio segue, because the third thing you said you would talk about in your keynote is what's next in our research into infection-associated chronic disease. You actually just gave a talk for the Friedman Brain Institute at Mount Sinai, where you went on for quite a long time about how many of the different people you got to collaborate with, people you didn't think you'd ever collaborate with in your career. And, and unfortunately it's for this, but showing the community that's coming together. So talk about, the future state. What is next in research into infection-associated chronic disease?
Yeah, I think on this front, we're really going to focus on what's next in our lab and what we're excited about. So certainly we're going to be collaborating with some really great folks, and we'll be talking about some of the interventional clinical trials that we hope to bring to light, because there has been, as everyone within the long COVID community knows, there has been no shortage of let's look, listen, and study long COVID. There have been precious few let's intervene studies with long COVID. And I know that has been a source of great frustration to the long COVID community. It has also been a source of great frustration here within our team and within many of the teams that we collaborate with. But it has been very, very challenging to treat something when you don't know the underlying pathology that you're trying to treat. It runs the risk that we will have a lot of studies with negative results that really could be studies with positive results if you selected inclusion criteria more closely and more carefully with an underlying understanding of the pathology. But I think that we're ready for some interventional trials, and I will talk about some initiatives that we're a part of that will be bringing interventional clinical trials to the forefront. But with that in mind, we're also going to talk about some of the clinical trials and observational studies that we will be doing to better understand the symptoms of long COVID, better understand what it is that a person with long COVID means when they report to us that they are fatigued. Because one of the things that has been striking to me is that there are many languages of fatigue, and we only have one or two scales that will measure one of those languages. What we need to do is we need to better understand when someone says fatigue, what exactly do they mean? What is, again, to go back to what we were talking about in the beginning, what is the quality? Let's not use a blunt instrument like the fatigue severity scale, which is what we're currently using because we don't have a better tool. Let's use a precision instrument to understand, is this fatigue because you have autonomic dysfunction? Or is it fatigue because your immune system is going haywire? Is it a combination of the two? Is it because of something else entirely? The better we have an ability to understand that using very well-constructed instruments, the more likely we're going to be able to very quickly start to stratify the different endotypes of long COVID so that we can really take a precision medicine approach and treat people with specific medications according to their specific symptoms. So that's some of the work that I'm going to talk about. This is ongoing work. This is work that is by no means perfect. It needs input from the community. As you know, Jimmy, at the Abilities Research Center, we always say nothing about us without us. And so we hope to be absolutely engaging the long COVID community as we start to answer some of these questions, because they are the experts on their disease and we're just the support team.
We usually do a thing on the show called 3 questions, but I'm going to change it to 3 people. So who are 3 people that have been instrumental in creating some of this information, who will be instrumental in creating some of this information in the future? This a chance is, sort of a nod to some people who've been doing great work. Who are 3 people the audience should know more about?
I would say 100%. Akiko Iwasaki is someone to look out for. She's one of the most brilliant minds in immune research and understanding autoimmunity that's out there. And check out her research; it's incredible. And we certainly would not be where we are in our understanding of long COVID without Akiko's work. Similarly, Amy Proel from the Polybio Research Institute is doing incredible work studying the effect of persistent viruses on long COVID and other infection-associated chronic diseases like ME/CFS and Lyme disease and many others. Amy's work has been tireless and really impressive. So definitely check out what Amy's doing. And then I'm going to cheat and just do a sort of a third/another, which is definitely Riccia Pretorius and Asad Khan. These are two individuals that have just been working tirelessly, and a special shout out to Asad because he himself has been living with long COVID for a long time, and I am constantly humbled by how much he can achieve whilst battling incredibly debilitating symptoms. So Riccia and Asad are part of a group that we affectionately call Team Clots, which is all about looking for microclots and platelet dysfunction in the blood and bodies of people with long COVID, and their work has been really flawless.
All right, we'll allow 4 on 3 people. It's fine. Last thing we do on the show is the parting shot. Again, the Long COVID Physio Forum. You can find out information at longcovid.physio. And yes, there will be a replay. David giving one of the keynotes there, as well as Emma Stokes from the World Physio. So the parting shot, what would you want the audience to be left with as we wrap up today's episode?
Everything that we have learned from long COVID, everything we have learned about long COVID up until this point has been learned because of the selfless collaboration of people with long COVID. So if you are a researcher or a clinician and you are not involving the long COVID community in your research and clinical practice guidelines, you are messing up. Don't mess up. Involve the community in all of your work.
Yeah. David Putrino, work at the Abilities Research Center, Director of Rehabilitation Innovation at Mount Sinai Hospital System. Thanks so much for stopping by. We'll make sure everybody knows all about the Long COVID Physio Forum and the continuing work that you do at Mount Sinai, as well as that resource, the Long COVID Physio. Thanks for stopping by.
Thanks for having me.